Florence. I'm the Director of Clinical Services here at the Herts Essex Fertility Centre. This morning I'm going to talk to you about a typical journey through the centre with us and the expectations you might have when you walk through our door. There's your starting point, walking through that fertility door. The expectations are really high. You need to have a referral. That can either come from yourself or through your GP or through a consultant, either your gynaecologist or urologist. We know how scary that stepping through that door is, but that's what we're here for. We're here to guide you and support you through the whole journey. First part of that journey is the consultation. That's a day when you'll come to meet one of our fertility specialists. They've been around a long time and they're here to guide you through what you might need to get you through that fertility. The consultation starts with a nurse assessment. You'll see one of my fertility nurse specialists and she'll take you through the first part of those consent forms. There are a whole array of consent forms that the Hfea demand from us, but that's what we're here for. We're going to talk you through those and make sure that we get those right at the beginning. Very key also before you start your journey is being fit for fertility. That's for both of you. There are no fancy gimmicks. This is just about making sure that you're both physically and emotionally fit for this journey. We talk about the rocky road of fertility, and it's very, very key that you're in that right place before you actually start. Once we've decided after that consultation that you do in fact need some treatment, then we can start scheduling when that treatment's going to take place and what's appropriate for you. The next part of the journey is what we call the treatment information appointment. This is the appointment where you'll sit down together with one of my fertility nurse specialists and we'll talk you through your fertility experience and what you're going to have to undertake. Very key before you start on this journey is screening. The Hfea, the Human Fertilisation and Embryo Authority, require that we screen all of our patients. It doesn't matter where you go in the UK, not just at Herts and Essex, but this is a requirement. And this is very important. We do carry those tests out here for you, but you can take that outside. You can ask your GP or your gynaecologist to support you with that. But what's very key is that you make sure that those results come from a UCAS accredited laboratory. And if it's your first cycle of treatment under a Hfea licensed centre, then those tests must be within 3 months of your egg collection. Very key to the journey is the medication. There will be lots of different medication at different times of the cycle. We talk you through that. We'll explain to you what medications are, what type of the cycle, what time of the cycle they're used on, and how to give them. That's very key. Okay, so once we've completed that TIA, we now need to make sure that we've got a uterus that's fit for purpose. We know that we've got eggs, our ovarian reserve is okay. We need to just make sure that that uterus has got no polyps or fibroids or endometriosis that would interrupt an embryo embedding there. And we do that by a simple procedure that's carried out here at the Herts in Essex called a saline infusion sonography. And we also at the same time can do what we call an endometrial scratch. And that's where we prepare the lining of the womb for your impending cycle. There's something that we will talk you through your consent for. We'll make sure that you fully understand that procedure before we embark on it. So once we've now decided that we have got a uterus that's fit for purpose, we're now going to start you on your treatment. And that's where you're going to start taking your daily injections. These injections are taken at the same time every day, but once you start taking those stimulation injections, we need to make sure that those ovaries are responding. And how we do that is through a transvaginal ultrasound scan. Again, that's carried out here at the Herts in Essex by one of our trained nurses or one of the consultants. These are less invasive scans. We talk you through everything that's going to be happening during the treatment and during the scan itself, so that you're fully informed always about what's happening. So the injections that you're going to be taking are called gonadotropins. These are powerful hormone injections. Of course, some of you may have experience or have some side effects from these drugs, but again, you will be informed fully about these side effects and what might happen or might not happen. We are here every step of that journey for you, so if you do have issues, do have problems with either taking your medication or worried about the side effects, then you call us. We do have a 24-hour-a-day nurse call system that ensures that you've got somebody on the end of the line that can talk you through the problems or the issues that you might be having. So once we've stimulated those ovaries, we're now at a point where we're ready to trigger, and that means that we're going to encourage those follicles to ovulate those eggs for us. And that's a timed injection that's given late at night, 36 hours prior to your egg collection. At that last appointment with us before your egg collection, we give you verbal information, written information, and then we support it through an app that we use. That's the time when we need to make sure that you're fully informed and you know exactly what's going to be happening in preparation for your egg collection 36 hours time. So now we've gone to the day of egg collection. This is the most important part of your journey for you as a couple. We're now going to retrieve those eggs, we're going to collect the sperm, and we're going to create those very important embryos. The anaesthetist will encourage and will support you through that and make sure that you're comfortable, you know exactly what's going to be happening during the procedure. When the procedure is finished, you're taken back to the recovery area and your partner will then join you again. And before you leave us, approximately an hour later, you will know exactly how many eggs we've retrieved, what the sperm is looking like, and we'll give you indication as to the type of treatment that you'll be having later on that day. The two main types of treatment that you could be having are these are either IVF or ICSI. IVF is where we're going to prepare the eggs, strip them down, prepare the sperm and put them together in that Petri dish. The ICSI is where we're going to do exactly the same, but we're going to actually inject a single sperm into each egg. Either way, that is the starting point for your embryo's creation. Following your egg collection, you will be sent home with instructions about what to expect when you get home that evening. And at that point, you'll be asked to start your progesterone support. So that's where we need to support your uterus to make sure that we've got a viable place for those embryos to embed. So following your egg collection, the laboratory staff will be calling you every day to discuss your embryo development with them. As we said, we're going to have the eggs and the sperm. We've created that embryo. We now need to think about when that embryo is going to be transferred back into your uterus. That can happen on either day 2, day 3 or day 5. And at Herts Essex we offer a 7-day-a-week service, so your embryos will decide for you when they're going to be put back. We don't make that decision. We create the embryos and we're going to wait for those embryos to develop and let us know when they're ready for transfer. If you've only got 2 or 3 embryos, the best place for those embryos is back inside your uterus. If you've got more than 3 embryos, we're going to push them and we're going to get them to that blastocyst stage, and at that point we put them back. You may have decided to have either 1 or 2 embryos put back, and we'll make those decisions with you and your consultant on the day of your transfer, and you'll actually see those embryos before they're transferred back, and you do get to keep that photo. Once you've had your embryo put back, we'll be guiding you as to when you need to do your pregnancy test. That can either be carried out at home and we'll let you know exactly what test you're going to need to use, or you can come into the clinic and we'll carry out a blood test and we'll know the results that day. We'll be guiding you then about your medication, what medication you need to carry on, and we'll be booking a pregnancy scan at approximately 7 weeks of pregnancy. This is the really important 2-week period. It's the bit that most of our patients struggle with, but it's very important to know that the nurses here at Herts Essex are here for you 24 hours a day, and if you're scared or worried about symptoms that you might be having, anything that you think you need to talk to us about, that's all we're here for. To give you some indication of what a long protocol at Herts Essex might mean to you while you're embarking on your fertility journey, how you're going to fit that rocky road of fertility into your work social life, from the beginning of your first injection right through until your pregnancy test, is approximately 6 weeks. Throughout that 6 weeks, you're going to need to attend for 3 to 4 scans, your egg collection, your embryo transfer, and then your pregnancy test at the end. This means a huge commitment for you. Before you think about embarking on a fertility journey, remember about the commitment that you're going to need to make to it. We are here to support you throughout every stage of that journey, at every point, and to make sure that you're fully informed so that you are part of the decision making throughout that journey with us.